on the show, we have Dr. Kamran Golmohammadi. He's the medical officer at the Office of the Chief Medical Officer at the First Nations Health Authority. And we're here talking again about vaccines and about some of the reasons people might be hesitant. We're hoping maybe we could dispel some rumors and myths with your help. So thank you so much for being here. All right. So first up, I have been hearing some crazy stuff. First of all, I watched a lady say that the shot made her magnetic. But another thing I've heard, which has a little bit more, like it makes a little bit more sense to me, but I'm just not sure, is that the COVID shot will change your DNA. Like, how true is that? Will it change your DNA?
The vaccines for COVID have nothing to do with our DNA. In fact, the vaccines are a way of stimulating our natural immune response so that we can fight the disease if the virus gets to our body. And it's a very safe and effective way of making sure that we are protected against the disease.
And how long are these vaccines effective for against COVID? Do you think we're going to need booster shots like we have for other different immunizations in the future?
So vaccines provide a long-term immunity against diseases, of course, as the virus might change and evolve over time. There might be a need for booster shots. At this time, we are closely monitoring the changes in the virus across the world. And to date, there hasn't been a serious plan to begin a booster shot program. But we are closely monitoring the information, and all scientists and vaccine experts are looking into the possibility that if the virus changes, then there might be a need for a booster shot.
And what about traveling? Because I know a lot of people are really excited to finally be able to leave the country, even leave their own communities. Do you think that people will need to be vaccinated if they want to travel in the future?
Yes, certainly. I think vaccines are a very effective and safe way of protecting yourself and your loved ones, not only at home, but also when traveling. We know that the virus in circulation and the number of people that might be impacted and infected across the world might vary. So in our region, the rate of the disease may not be really high, but if you are traveling to a place that more people are sick, of course, you are more at risk to expose yourself to the virus. So this is a good way of protecting yourself and your loved ones, but also it can be a requirement for countries as part of the requirement for entrance. So we encourage people who plan traveling to ensure that they look and review the requirements in terms of vaccination for the particular destination.
And there's a lot of different kinds of vaccines I've been hearing about. Like myself, I got the Pfizer, and then I went to an FNHA clinic and I ended up getting the AstraZeneca, I believe. Why are there so many different kinds of vaccines?
When the pandemic picked up across the world and across the globe for COVID, we realized that this is a very serious situation, and many nations and scientists across the world committed and worked together to find ways and approaches with vaccine to protect people. So while there has been some collaborations among nations, there has been many centers and groups that simultaneously worked tirelessly to develop vaccines. And in Canada, 4 COVID vaccines to date, which is mid-July now, mid-July of 2021 so far have been approved, and we strongly believe that all of those approved vaccines in Canada are safe and effective against the disease.
And I know there's a lot of concern about the mutating virus. The Delta variant has been really taking over in some communities. Are the vaccines still going to work if the virus is mutating like that?
We closely monitor the viruses in circulation. And as you mentioned, the viruses continue to evolve. So far, the Delta variant that you mentioned seems to be really effective in spreading from person to person. In fact, several times more effective than the originally identified COVID virus. However, we are very interested and very closely monitoring whether the vaccine that we are providing provides a good protection against any variant that might emerge. So far, we are confident that the vaccines available in Canada provide an effective protection against the Delta variant, and we continue to monitor for possible variations or changes in virus that we accordingly might require to make changes in our vaccines.
And I know a lot of people are waiting for that time where we feel or we get the go ahead to just go back to normal, but that won't happen until we have community immunity. When do you think we'll reach that?
So community immunity is basically when there are so many people in our communities are protected, so that when one person becomes ill with virus, even despite the possibility of shedding that virus will not infect others, so that basically it will not be able to spread. Various numbers are presented for various viruses, depending on how effective they are in spreading, from 50-60% up to 90 and 95% or more. Initially, when the COVID-19 virus was being investigated, a percentage of 70% was introduced. However, what we know now is that the more we protect our community members, the better we can fight the spread of the disease. Therefore, we strongly encourage people to, all people who are eligible for the vaccine, to immunize, because there is always a chance for pockets of less than optimal immunity in our communities. And also there might be a possibility for some people that may not be able to take the vaccine and they remain unprotected because of their medical condition or contraindication or so on. Therefore, we encourage everyone to take the vaccine, which is a safe and very effective vaccine against the virus, not only to protect themselves against the severe outcomes and death that is possible due to COVID, but also to protect our community members, our loved ones, our families, our neighbors, and so on.
And what about children under 12? Because they're right now in that category that can't be vaccinated. When do you think the vaccine will be approved for kids 12 and under?
Right. So the reason at this time the vaccines are not approved for children 12 and under is not because the vaccine may not work in them. In fact, the only reason is the stringent process for vaccine approval for any person. So the initial clinical trials that were conducted were on on older people, 18 years and older, and then for 12 to 17 years. And now there are several clinical trials ongoing to demonstrate the effectiveness and safety of the vaccine against COVID-19. So as soon as those information become available, Health Canada will review those information and then will decide on vaccine products that are indicated and approved for children less than 12 years old.
And what about people with pre-existing health conditions or, medical histories that might have some concerns? Should they be going and talking to their doctors ahead of getting the vaccine?
That's always a great idea to work as a team with your primary care provider, with your doctor that is involved in treatment of your ongoing health condition. What we know, in fact, people with chronic medical condition, in fact, could potentially be at higher risk of severe outcomes. For example, those people who have heart conditions or those people who have the respiratory condition, they might experience severe outcomes that sometimes could be even deadly. Therefore, not only we recommend and advise everyone to consider and make sure that they take the vaccine as soon as possible, but it is dually important to make sure that if you have a chronic medical condition or an ongoing medical condition that might put you at additional risk to get your vaccine timely. There are very rare circumstances that people who are receiving certain treatments for their ongoing health condition that might need to space an interval between the treatment. Most likely, those are the ones that are called immune suppressive treatments. So because the vaccine is a way of stimulating our natural immune system, and if you are at the same time or simultaneously taking an immune suppressant, it may not work together. So it is best at that situation to have your primary care provider and medical team involved in working together with public health specialists to ensure that the spacing and the timing is right and you are protected against COVID-19.
And I know a lot of people are going to be waiting for me to ask this question, especially the people who've been doubly vaccinated. Once you get your 2 shots and you're 2 weeks past the second vaccine, can we drop the masks?
So as you are aware, in BC, effective 1st of July 2021, the mandate for wearing masks by the public has been removed. That, however, does not speak to how the masks could work and how the vaccine could work. So basically, the prevention of spread of illness is multiple folds, and basically it consists of what we do in our communities to minimize the risk of spread of virus, and also how protected we are against the virus. What is known with COVID vaccine is that it protects us against the severe outcomes of the COVID-19 and not necessarily against a mild infection. So people who are immunized could still become infected with virus and could still theoretically spread the virus. Therefore, it is advisable and recommended if you are getting into crowded areas, particularly in indoor spaces, and when you are entering in areas that you get closer to people and your distance is less than 6 feet, to wear mask. This way, you are not only protecting yourself and adding one layer against spread of disease, but also protecting others.
And when we talk about reasons to get vaccinated, I know my personal reason is I'm a huge Disney nerd and I just wanted to be able to travel and go back to Disney World, but everybody has their different reasons. What was your personal reason?
My personal reason was to ensure that I am protecting myself against severe outcomes of the disease, because unfortunately, to date, in Canada, the disease has caused more than 26,000 deaths. So it is a very serious condition, and the pandemic has caused a lot of morbidity, which is hospitalization and severe illness and mortality. So not only to protect myself, but to protect my community members, my family. For example, I have a child that is less than 12 years old and still not protected. And you never know how a person who is infected could turn out. It could be a severe condition and devastating outcomes if someone becomes ill. So for that reason, I felt that it is very important for me, as soon as I became eligible in terms of priority, to get vaccinated.